I'm Marcy Turcos. I'm a physical therapist and a certified wound specialist and one of the Derma Sciences clinical field specialists. Over the past several years, the science behind wound care has been advancing significantly. This is one of the reasons why we really need more education about it. Derma Sciences is an innovative company providing novel, technologically advanced products for wound care. Bioguard and Algicel Ag are two of the differentiated products in a growing line that is giving us more options in the important area of infection prevention and treatment. MRSA, along with other resistant strains of bacteria, are a growing concern. Surgical site infections now top over 500,000 cases annually. This is more than HIV and AIDS. The average cost of surgical site infections is over $24,000, and Medicare is no longer paying for certain surgical site infections. Antimicrobial dressings have become quite common in advanced wound care, but not all are the same. When talking about infection prevention, some dressings may be too toxic for prophylactic use, and others may have leaching antimicrobials, which can lead to the development of resistant strains. How does Bioguard address these issues? Bioguard is different. It's a barrier dressing designed for prophylactic use to help prevent infection in wounds. With Bioguard, there's no cytotoxicity to the healthy cells, yet bacteria cannot develop resistance to it. It's cost-effective and easy to use. The active compound in Bioguard is polydadmac, which is a cationic biocide. Its mechanism of action is that polydadmac attracts bacterial cells, binds to them, and disrupts their cell wall, destroying it. This active molecule in Bioguard is up to 100 times larger than the one commonly used, PHMB. Because it's too big to actually enter the bacterial cell, bacteria can't learn about it and therefore cannot develop resistance to it, even over a long period of exposure, as the studies have shown. The leaching of a biocide from a wound dressing leads to a zone of inhibition beyond the dressing itself. Beyond that zone, there will exist sublethal levels of this biocide, which can lead to the formation of resistant strains of bacteria. Bioguard's polydadmac is intrinsically bound to the substrate, unlike PHMB, so there's no leaching. Bioguard shows no zone of inhibition. Its effective rate of kill is extremely high over a broad spectrum of bacteria, and Bioguard is fast-acting, killing over 99.99% of most bacteria within minutes. Bioguard has several unique benefits. Even in the presence of bodily fluids, it continues to be active, unlike other dressings. It's bound to the substrate, so there's no leaching. Bioguard is not toxic to healthy cells. Its larger molecule prevents the growth of resistant strains of bacteria, and it's fast-acting over a broad spectrum of bacteria. Bioguard comes in a large gauze roll, as a conforming bandage, and as gauze sponges. Algicel Ag is another Derma Sciences product with a difference. It's a silver-impregnated calcium alginate dressing with 7-day antimicrobial effectiveness, superior absorption, and is also highly cost-effective. Silver is an ancient remedy that has come back into greater usage in the last decade. Today there are silver hydrocolloids, hydrogels, foams, fabrics, and films. What are some of the issues around these varieties of silver dressings and their usage? How much silver is needed? What's the duration of the antimicrobial activity? How much absorption does it provide? Does it gel? Does it remove in one sheet, and does it leave any fibers behind in the wound bed? Derma Sciences has created Algicel Ag to address all of those issues. Algicel Ag has ionic silver, allowing for a consistent, slow release of the silver, resulting in an antimicrobial effect that lasts for up to 7 days. It shows superior bactericidal action from the start, and it's effective against a broad spectrum of bacteria. Algicel Ag also absorbs 16% more drainage than the market leader. This reduces the risk of maceration, and it may reduce the need for or decrease the frequency of dressing changes. As Algicel Ag gels, it keeps the dressing from sticking to the wound bed. It also removes in one piece without leaving portions of the dressing or any fibers behind. Algicel Ag has additional benefits over the market leader. It's stronger when wet and more absorbent. It gels well so it doesn't stick to the wound bed, and it shows a longer antimicrobial duration. All of this can add up to significant cost savings. Bioguard and Algicel Ag are part of a growing line of Derma Sciences products with unique differentiation. At a time when wound science is becoming more important, Derma Sciences is dedicated to providing novel technologies to advance the field of wound care. For more information about these advances, please watch the other videos in this series.